Welcome and thank you for joining us. And to all those who observe, Ramadan Kareem. We're going to give folks another minute to join the call while we wait to get a sense of how many of us are on the call today. We want to just hear, some of us are caring for our loved ones, some of us are caring for our parents, some of us are caring for our siblings, our neighbors, our clients. Who are you providing care for in your life? And how has your care situation changed during the coronavirus? Let us know in the comments, and we're going to wait to get started in just 1 minute. Okay, so while you're sharing your care stories with us, I want to welcome our first guests for our Care for All Coronavirus Care in the Time of Coronavirus Town Hall. First, I want to welcome Aminatou, who wears a ton of hats. She co-hosts the podcast Call Your Girlfriend with her best friend, journalist and editor Ann Friedman. Together, they wrote a book called Big Friendship, which is coming out this July. Aminatou is a businesswoman, a digital strategist, a writer, a general badass, and co-founder of Tech Lady Mafia, which aims to boost women on the tech world ladder. Welcome, Aminatou.
Thank you so much for having me.
Yes, I'm so happy you're here. We are also joined today by Natalie Gontcharova. Did I do that correctly, Natalie? Excellent. And Natalie is the senior news and politics editor at Refinery29, where she's been an editor and a writer since 2014. She covers topics such as women in Congress, youth activism, and the presidential race. Dun, dun, dun. Her writing has also been published in Time Magazine, in Good Housekeeping, and in Elle. Welcome, Natalie. Thanks for joining us.
Thank you so much for having me.
So we all know that care work is essential work, and that's what we're going to spend our time together talking about today. This isn't new. Care work has been around since human beings have been on this planet. Our families, our economy, our society has always relied on care, and every single one of us at one point in our lives is going to need care, and every single one of us has provided care in some way, shape, or form. But the problem is that care work is often hidden. And as a result of it being hidden, it's not valued, it's not respected, and it's not dignified in the way that it should be. More and more of us are becoming caregivers in this moment. We're caregivers for our loved ones, for people we don't even know. And in the midst of this crisis, it's clear how essential caregiving is to all of our lives. And caregivers deserve to be lifted up. So what we know is that the front lines of this crisis begins in our homes. Family caregivers and domestic workers are the backbone of our care ecosystem. And at this moment, domestic workers and caregivers are also vital to our collective health and well-being. This is why we wanted to create this town hall today. We want to give some support to all of the caregivers out there, and we want to talk about what we need, how we care for ourselves, and how we care for one another. In other words, if all of us are providing care in this moment, who is providing care for the caregivers? So for me, care is personal. 2 years ago this month, actually, my mother passed away from a very rare form of brain cancer. It came on very suddenly. And I found myself becoming a family caregiver in a way that I hadn't imagined. I had supports that I needed. I had a supportive family, a supportive and flexible work environment. And I also had hospice caregivers who were helping me fill the gaps where I could not be with my mother at the time when she needed me the most. I came to understand how essential caregiving is to the very fabric of our society. And I know that if I had not had the supports that I had, I wouldn't have been able to be there with my mother in the most precious times at the end of her life. Those are memories that I cherish and that I take with me every single day. And these are supports that everybody in this country deserves. So I want to invite Natalie and Aminatou to talk to us about your care stories. And Natalie, I'd like to start with you.
Sure. Hi. As you said, my name is Natalie. I'm the senior news and politics editor at Refinery29. My family, which is my mother, my father, and myself, came to the US from Russia in the early 90s. Um, my mom passed away from acute myeloid leukemia in April 2018, which is also about 2 years ago now. She was diagnosed about a year earlier, and at that time I was living in New York and working at Refinery 29, and she still lived in DC. Um, Her diagnosis completely shook up my family's life. Outside of my mom and dad, my entire family lives in Russia. Um, During the initial stages of her diagnosis, when she was in a lot of pain and needed multiple biopsies and other procedures, I was her primary caregiver. All of a sudden, I found myself just living in the hospital, living at Johns Hopkins, often sleeping in the armchair in her hospital room. And at the same time, I was also working a demanding job in journalism. I was doing interviews, writing, taking meetings in the hospital hallways and cafeteria. And at the same time, I was still like bringing her all of her meals, helping her go to the bathroom, everything that she needed, in addition to being there for her emotionally, because it was obviously a really, really scary time. I also had to advocate on her behalf to nurses and doctors and the insurance companies, because there was a real language barrier. Even though she spoke English, she's been living here for a long time. It's not her first language, and it's not easy to deal with certain information when it's not your first language. So this experience was a lot more isolating than it should have been for me. There were support groups for caregivers at the hospital, but I didn't really have time to attend emotional support meetings. What I really needed was concrete advice on how to get my mom the full-time care that she needed that was also affordable, when we did, come home from the hospital. And that was not available. That bridge, the healthcare system did not provide that. After she was diagnosed, she went into a remission in the summer of 2017, which we were really happy about. And she was actually able to attend our wedding, which was really a happy moment for us. But then in January 2018, her cancer came back. And now I really needed a long-term plan for how to take care of her while still being able to do my job and still being able to get paid. Luckily for me, this was also the month when the New York State enacted its paid family leave program. Paid family leave was instrumental to our family, because I was able to take 2 weeks off and just be with her, because she was in and out of the hospital with a lot of complications and fevers at this time. But it made me furious that not everybody in the US has access to it. And although several states have enacted programs, we're still the richest country in the world that doesn't have a federal paid family leave program for everybody. It just means to me that as a society, we're not prioritizing policies that support caregivers. The other piece of this is that a couple of months before she passed away, doctors and nurses told me that my mom needed several injections of antibiotics and fluids into her catheter a day. These had to be done at very specific times, and they required considerable manual dexterity. I was terrified because without an education as a nurse, giving those myself, I was really worried that I would mess up. And after doing some research and asking the nurses and doctors, they basically told me that there's no, you have to do this yourself. There's no solution here. There's nobody else who would provide this kind of service. And when I asked what happens if I have a full-time job, if the caregiver who has to give those injections have a full-time job, I got no answer. And as I'm sure a lot of people know, private nurses are prohibitively expensive and very hard to hire. So I basically had to learn how to be a nurse in a very short period of time. This caused me, at first it caused me to feel angry at the system, but also it caused me to feel guilty that I'm not available or as adept as I should have been. Now, with a little bit of time to think back on it, I realize now that this is a lack of safety net, the healthcare system leaving us to our own devices, and that it's no fault of my own. We really need to provide caregivers with a community so that they feel less isolated, and we need to provide them with better solutions. If my family and myself, we had access to health insurance, ability to work remotely, paid family leave, if we felt so isolated by this process, then what is it like for people without these resources?
That's a really important set of points, and I so appreciate you sharing your story with us. It's true, there are so many supports that are not wrapped around caregivers that are incredibly necessary. Aminatou, could you share your care story with us?
Of course. Thank you so much for sharing that, Natalie. I really appreciate it. I am in my mid-30s, and it's interesting because I have both been a caregiver and someone who needed care. And on both sides it's so apparent how little support there is. When I was 20 years old, my mother passed away very suddenly, and all of a sudden I was in charge of raising my brother and my sister and stepping into like being a full-time parent essentially for both of my siblings. And in that moment, if I could go back in time, the things that I really needed were, I needed resources. Nobody tells you what to Google or where to turn to, or exactly, like which agency is in charge of telling you what, the kinds of help that you need. And also clearly the other thing that we needed was cold hard cash, and thinking through so many problems that caregivers have are not necessarily completely alleviated by money, but money plays a big part in the reason that caregiving is so hard in the first place, because it is really expensive. And as Natalie pointed out, someone also has to work full-time a lot of times to, in order to be able to even afford to have people who are home who are sick that you were taking care of. Fast forward all of this to me to 2 years ago, when I was a cancer patient myself, who had been through a couple of years of just like intensely debilitating chronic illness. And to finally get a cancer diagnosis, to me almost felt like a relief, because it meant that there was now, there was a name to the thing that I was experiencing, and there was maybe a path out of it. And that relief was really shortly lived, because the reality of people who have cancer is that you do require a lot of care on the other end. And so, at this point, I am a single person who still financially supports most of my family. And so for me not to be able to work has a lot of consequences and repercussions like down the line. And because I'm someone who, didn't have a partner at the time or a built-in family structure that was around me, my family lives overseas. A lot of my friends had to step in to figure out what my care looks like. Everything from how I was fed every day, to how my house got cleaned, to who was going to help take me to the doctor, who is going to help administer the medicine that I need, who will be there when I am home from chemo or from radiation. And, I am a really lucky person in that my friend network really figured it out, and we did it, but it does come at a considerable cost. And I think that the privilege even of having a network of people who will really drop so much to do it was, that's not lost on me, that is something that I have that a lot of people, just emotionally do not have, and also emotionally cannot afford. I think that something that was really interesting in my case also is that, my community really stepped up to fill in the gaps that are, usually tended to by this traditional idea of what family is. And I think that having your chosen family step up in that way also meant that we could get creative, and it meant that, you know, the burden really could be shared. I would say that my team of caregivers was like 5 very core people and an extended network of truly dozens of people. I never went without, and, you know, but I still recognize how tough it was. And so to Natalie's point about, you know, really not knowing to turn to, this was another place where there were no consolidated resources. We just all had to figure it out. I am someone who is self-employed. I am not a US citizen. And so a lot of the financial help that is available to US citizens is not available to immigrants, usually, to tap into. And so I was really lucky that all of the self-employment that I have, my partners agreed to run while I was sick, you know, and that's something that like not a lot of people have an opportunity to do. So I still had income. I had a really healthy savings I could live off for a whole year while I didn't provide for myself. But you know, I keep thinking so much every time I would go to the hospital, I would look at people around me and say, how are all these people doing it? I know the like 5 people who keep my life going, and I know how lucky I am to have that. And, you know, the cancer wards are places where you really get to see what people's like lives are made of. And so I was also really lucky through the hospital to connect to an emotional support group that at the beginning I was really reluctant to go to because it felt like such an extravagance. And, you know, I would say that now, you know, 2 years out in remission, that emotional support was really key for getting me healthy. And again, that is a resource that is just, you know, whether you are time poor or cash poor, it is a thing that is really hard to access. And, you know, I just keep thinking so much about how anyone can be thrown into a situation where you are someone who needs care or you are someone who is giving care. And in both cases, there is just a big question mark of how do we make it work, you know? And the fact that all of us can even be on this Zoom to talk about it, like, speaks to a real level of privilege that a lot of people who are thrown into these situations just do not have access to at all. And, you know, and so if it's hard for us, God knows how much harder it is for someone else. And so I really appreciate that we're having this vital conversation.
I so appreciate both of you sharing your tender stories. One, you know, it's so tough to lose somebody that you love and that loves you. And so sending my heart out to both of you. I also just want to recognize, right, that some of the commonality between both of your stories is how hard the care system is to navigate. The care system does not care for us. There's no manual that you can get that tells you how to navigate this very complex bureaucracy. And whether it be your immigration status or language barriers or economic barriers, care should be more accessible to everyone. I know the people that are out here listening right now and you're watching, you have your own care stories as well. And these stories are important, and we want to hear from you. You know, how are you taking care in this moment, in a system that is so incredibly complex to navigate, and in a system that's so incredibly expensive to take advantage of? And what is the impact that that has on our families and our loved ones and the fabric of our relationships? If we have family and communities that care for us, that's so important and seems so vital to what it means for all of us to stay connected. But there are so many of us for whom those bonds are broken, and those folks still also deserve to be able to access care. We all do better when we pull together and we care for one another rather than going at it alone. And I appreciate you both for really lifting that up. Caring Across Generations and the National Domestic Workers Alliance, we created the Care for All campaign to be able to bring attention to the caring majority, which is the caregivers and care workers who are so often invisible and undervalued. And we hope with this work to be able to build a culture of care across communities and across generations. So now we're going to hear from 2 more caregivers in our communities, Natalie and Aisha.
My name is Natalie Dunn, and I live in Seattle, Washington. I became a caregiver about 3 years ago. My mom suffered a massive hemorrhagic stroke. I moved to California and cared for her full time for about a year. And when she was recovered enough, I moved my whole family up here to Washington. And I'm back at work, and I help my dad take care of my mom and my disabled sister part-time. It's really hard, but it's also really joyful. Sometimes when I tell people our story, people seem to feel sorry for us, but I want people to understand that I'm proud of caring for my family, and I'm so grateful to have my mom and my sister as part of my life. I do worry a lot about when it gets to the point when my dad is unable to do a lot of the caregiving and how I'm going to balance that out. How will I balance working and taking care of them? Will I have to quit my job? Will we be able to afford a professional caregiver? The hope for the future is that we live in a society that values both those who need care and caregivers. How can we create a system where caregivers receive fair pay and good care is affordable and accessible for all the families that need it?
Hi, my name is Alicia Adkins, and I am in Atlanta, Georgia, where I've provided care for my mother since she was diagnosed with dementia in 2013. As a caregiver, I make some really challenging and difficult decisions on a daily basis about finances, about medication, about medical procedures. These decisions are further complicated by the really deplorable history that the United States has with health inequity in the Black community. Now with COVID-19, reports are showing that Black folks are overrepresented among COVID-19 diagnoses and deaths, and it's really alarming. I worry that my high-risk family, should we need to go to the emergency department, would be cast aside because we are high risk, and that those high risk conditions are associated with social determinants of health that is tied to systemic racism. And I just wonder, what kind of care will we receive?
There's so many important themes in those videos. I mean, one, we could, of course, talk about the disparities that exist in Black communities where structural barriers and racism affect the ability to access the kind of care that Black communities deserve and receive. There's the theme about, who is disposable. And I think, honestly, we should all be able to say with a resounding voice that nobody is disposable. Communities of color, people with disabilities, people in nursing homes, we all deserve care. We know that another theme that we saw in these videos is that we're all having to make really hard decisions about how to prioritize things, whether it be life priorities, money, time. How do you work and care at the same time? Does somebody step back so that somebody else can step forward? What is the pressure and the strain on our relationships when we make those kinds of hard and terrible choices? There's also just this theme of the dignity and pride in what it means to give your best care in a situation and in a dynamic where somebody really needs it, somebody that you love, somebody that you're connected to, and how love and humanity is at the core of all of that. Our entire society is connected by the bonds of caring for each other and caring for ourselves. And then, of course, finally, I mean, we all should be able to say this too with a resounding voice, that care shouldn't be only accessible to people who can afford it. Care has to be affordable, and it has to be accessible to every single person who needs it. So thank you, Aminatou and Natalie. You both have been incredible. Thank you for joining us and taking your time to share your stories with us today. You can keep up with Aminatou and Natalie on Twitter. You can catch Aminatou at Aminatou, and you can catch Natalie at Natalie Reports. You can also follow me at Alicia Garza, and you can join the Caring Across community by texting CAG, C-A-G, to 97779. Caring Across Generations works in deep partnership with community organizations across the country This includes groups like the New York Caring Majority, Citizen Action of Wisconsin, the Jane Addams Senior Caucus, Take Action Minnesota, Iowa CCI, and so many more. Before you all go, as a part of our Care for All campaign, we have a big favor to ask. We are collecting photos of caregivers and domestic workers striking the pose of Rosie the Riveter. Can y'all hit the pose with me real quick? And our team is going to take a quick screenshot. Ooh, so good. All right. That's it. That looks excellent. And for all of you who are watching at home, we want to see your selfies too. Show us those muscles. Show us the caregiving muscles you've built. Strike the pose and hashtag care for all. Okay, next video is coming now.
Hi, I'm Sarah Coletti, and I live a little bit west of Boston. I'm a caregiver of 30 years of my son and my mother and my father. My son is here with us during this pandemic. He normally lives in a group home. My mother is in an assisted living place, and my father has just been moved into the VA, a hospice unit there. He's had Alzheimer's for over 20 years, and my mom's had Parkinson's for almost as long. I have a second circle of people that I worry about, and those are the people who care for my loved ones, from the direct service providers in the my son's group home, and the certified nursing assistants and staff at my mother's assisted living place, as well as at the VA. And these are dedicated, compassionate people who've really, become very important to me. When I used to be able to visit my mom and dad, we would often connect there. One of the things I learned recently was that the staff at my son's group home have been getting a $5 an hour raise during this pandemic, which is called hazard pay. And I think this is just great because it allows them to give up their second jobs. So no longer leaving the shift in order to go drive Uber or to go work at some other home or do the overnight somewhere else. They can have one job, which means that they and their family and the residents are safer for that. And my question is, why isn't this true all the time? Why can't they earn that amount so that they can have one job, earn a living wage, do the work that they love and that they're good at, and take care of my loved ones? It's enough. That's hard enough work, believe me. And that's what I wish, is that they would get paid well.
Welcome, Jennifer and Kristin, and soon to be iGen Poo. Dr. Jennifer Olsen is an experienced epidemiologist and serves as executive director of the Rosalynn Carter Institute for Caregiving, which promotes the health, strength, and resilience of caregivers throughout the United States. She formerly managed the Ending Pandemics in Our Lifetime initiative at the Skoll Global Threats Fund. You sound like somebody we definitely need to be talking to. Kristin Rowe-Finkbeiner is the executive director and CEO and co-founder of MomsRising and board president of the MomsRising Education Fund. She has been involved in public policy and grassroots engagement for more than 2 decades. And she is also an award-winning author, media contributor, and radio host. Kristin is also a former political director, policy analyst, and political strategy consultant for nonprofit organizations and foundations. Welcome, Kristin. And we just heard from Sarah from Massachusetts. She told us about caring for her son and caring for her parents and the professional caregivers that her family depends on. care workers at the home where her son lives are getting hazard pay during this pandemic, which is awesome. And it's allowing some of the workers to afford life with only one job. She asked a really important question, which is, why don't we pay our care workers living wages all the time? This shouldn't just be during the time of crisis. In fact, a time of crisis is where we expose, right, the bonds that weren't there to begin with. So this is a great opportunity for us to be putting infrastructure in place. We know that crises happen, but we have an opportunity to prepare for them so that when they do hit, we're not caught off guard and we have the infrastructure necessary for people to respond as they need to. All of you who have joined us today, your story and what you're going through right now, it has the power to change things for all of us. We want to hear about your experience. We want to hear what your needs are, and we want to know how we can do better together. Tell us what your questions are. Tell us in the comments, and we want you to join us by texting the number that you see on your screen now. Jennifer and Kristin, while people are texting us and joining our movement, I want to know if both of you would share a little bit about yourselves and your personal care stories. How did you become major advocates around care? And Kristin, I want to start with you.
Thank you. Like so many others, my story, my journey into this advocacy movement started with a crisis of care. My son, when he was born with a primary immune deficiency. We didn't know what was making him get sick over and over again, but it turned out he was deficient in one of the primary parts of his immune system. And so it meant that I unexpectedly had to quit my job because I didn't have access to any paid family medical leave. I didn't have access to any of those critical supports that we still need today. And it was a moment where I realized that I was incredibly lucky that as I quit my job, I was able to still keep a roof over our heads and food on the table because I had the majority of my life, my mom was single. And if this crisis, this unexpected crisis had happened to her, it would have been an outright absolute disaster because for too many families, it's a free fall. In the United States of America, the work of caregiving, both paid and unpaid, is deeply undervalued. It's undervalued so much that it hurts our economy, it hurts our families, it hurts our communities. And it's so clear, the writing is absolutely on the wall, that when we value caregivers, we value all of us. And doing that is good for everyone of all ages and all generations. So that sparked my engagement in this area, just realizing personally that it's an absolute free fall when you have a family crisis. And then realizing that I'm not alone. My family wasn't the only one. This is happening to all families in some way or another, to some degree or another, with different impacts on different communities and different families across our country.
That's right. Thank you so much for that, Kristin. We have a lot to talk about with that. Jennifer, can you share your care story? Tell us, how did you become a major advocate for caregiving?
Sure. I'm what I'd like to call a secondary caregiver. Both of my parents were caring for another individual. And I watched their journey and their struggle. And I thought, well, there must be resources. There must be ways that this gets worked on. You know, I'll use my fancy Google skills, or I'll use my fancy public health skills and I'll find solutions. In doing some of that work, I realized that the public health system and our population health approach doesn't actually embrace the challenges that caregivers face. Their mental health and physical health challenges and the wellness challenges they face, not even to mention all the economic challenges that people have brought up today. And so that changed my look at caregivers as a population who we need to recognize and support in various ways, because they are in a lot of ways vulnerable, but they're also the most critical. If we take care of caregivers, they're going to keep our population healthy right now more than ever.
That's excellent and so true. Again, why do we wait until things fall apart to try to figure out how to put them back together again? We are also joined by the Executive Director of the National Domestic Workers Alliance and Caring Across Majorities, Ai-jen Poo. Ai-jen, We had a question earlier in this discussion where we know caregiving is so vital. We know that there are things being put in place right now to try and make sure that caregivers can care for themselves and care for the people that they love. But why is this an emergency measure? Why are we not paying caregivers living wages all the time?
It's a question I've asked so often. It's so good to see you women and be in conversation with you, some of my favorite people. So I would say this, that caregiving has always been associated with women. And unfortunately, we have a society and a culture that has really undervalued the contributions and the work of women, and taken a lot of it for granted. And as a profession, care work has always been associated with women of color and immigrant women and women of marginalized social status. And too often, I think we value people and our value work in a way that reflects how we value the people who do it. And unfortunately, in this situation, it's so clear that we have a hierarchy here, and that we have undervalued and taken for granted the work that women and women of color have done for far too long. It's kind of the other side of the pay equity challenge, where Latinas and Black women and Native women are valued so much less. Their work, even if they're doing the same exact work as men, earn so much less. And so I think it's just another side of that. But the reality is that we have an opportunity to change all of that right now. I think everybody is so in touch with just how essential caregiving is, and how we all suffer when we don't value caregiving and caregivers, and how much more fragile a society we are when our caregivers aren't supported and really invested in as an essential part of society and our families. And so I'm really, I'm feeling really hopeful that as we emerge and think about what it looks like to recover from this coronavirus crisis, that solutions that support caregivers will be at the center of it, which is why I'm so excited we're having this town hall, and why I'm so excited everybody's tuned in today. And I have on my mind my mom and my grandmother right now, who I just left. My mom has been a full-time caregiver for my grandmother for 2 years now, and ever since she retired. And she is just a hero for all of us and our whole family. And so I really have that present for me right now.
Well, thank you for being here. I know you're in the midst of your own care story. And for all of you caregivers who are watching, I'm sure none of this comes as a surprise to you. I have seen families actually fall apart because of the lack of supports that we give to caregivers. When people have to make untenable choices without supports beside them, behind them, in front of them, it breaks the bonds that holds us together. That's why this town hall is so important. We want to lift up the bonds that keep us strong, not just as families or communities, but the bonds that keep us strong as a country. We're so glad to have all three of you joining us right now, and thank you for taking the time on a Sunday. We've asked a couple of caregivers from the Caring Across Generations community to share their stories with us today. We're going to hear from Jeffrey and Bobby. They have a couple of questions for Jennifer and Kristin.
Hi, my name is Jeffrey Adam Kearney, originally from Pine Bluff, Arkansas, and now reside in the one and only Southeast Washington, D.C. And I'm a caregiver for my beautiful mother, Michelle. Our care journey of navigating a system that at times seems to defy logic has included a great deal of uncertainty, but I reckon also a very generous sprinkling of miracles over the years. My concern is the trajectory of access to care and living wages. Those who care in countless respects master meeting demands in the moment while not having access to compensation that recognizes the magnitude of quality care. Will forthcoming stimulus packages or other legislation begin to actually address caregiver needs?
Hi, I'm Bobby Sackman. I live in Brooklyn, New York. I'm a native New Yorker. I'm active with the New York Caring Majority Coalition, Jews for Racial and Economic Justice. I spent my whole career doing advocacy on behalf of older adults so they would get the services they need to age in place. And I was catapulted into this career by the pain I saw my mother go through when my grandmother was in a nursing home and just couldn't get the care she needed. My question today is, how do we use this political time as an opportunity to build the feminist caring majority we always talk about, to build the economy we want? How do we do that, and how do we do that together? Thank you very much.
Okay, and we're back. So let's have a conversation. We've got so much to talk about. I mean, why is this care system so convoluted? Can either of you just talk to us a little bit about why is this thing such a mess when it's something that we all depend on so much? Kristin, how about we start with you?
Why it's a mess is a tough question.
Oh, yes, excellent. Well, I mean, give us your best shot.
I would say it's disconnected. And in a lot of cases, caregivers are the central node. A caregiver knows when somebody's got a fever, whether they're in a facility watching somebody that they check on every day, or when that individual doesn't want to play, chess like they do, right? That's an indicator of something being different. The same is true for family caregivers who are at home and notice a shift in mood or a symptom in the person that they care for. That person's the person who will tell the doctor, tell the nurse, tell the facility, and tell the specialists, because we don't have a systematic way to connect all those different pockets. And that caregiver has to remember to keep track of medicines. I'm sure Kristin probably has to bring a list of all sorts of medications and all sorts of things for her son at various points. She's the central node of information and insight for his care. And that's part of the problem. And that's why caregivers are so critical.
That's excellent. And so clarifying that actually these systems weren't built around the people who are providing care, and they're very disconnected from the everyday realities that people are experiencing. So, Kristin, we're hearing all this stuff about stimulus packages. I know, every couple of weeks we hear like there's a new thing being passed through Congress. Give us a short answer. Are any of these stimulus packages or any other legislation even starting to address caregiver needs?
We've had the beginning start of some measures that are addressing caregiver needs, but it is not by any means the end or even the middle. I mean, we absolutely, in the next package, and we first of all have to fight for a next package. It's not guaranteed that we will have a next package. So everybody who is listening, who is watching, call your member of Congress and tell them to keep moving for caregivers and for families, because we need to protect childcare workers. Childcare workers are on the edge, and that means 50% of our childcare centers could close permanently because of this pandemic. So we absolutely need to lift up childcare workers. We also need to lift up paid family medical leave and sick days to make sure that each and every single person, no matter where they work, no matter what their background, no matter what they're doing, has universal ability to take paid sick days and paid family medical leave for now and for always. We need to make sure that we're building back better the crisis that already was existing in our system that is now a catastrophe. Healthcare, for goodness sakes, everybody gets sick in some way or another. Hopefully not everybody gets COVID-19, but everybody at some point gets sick. We need universal healthcare. We need to protect frontline and essential workers in all ways, and they need hazard pay in addition to fair pay. We need to have increased direct payments, more UI, and we need to also protect immigrant families and make sure immigrant families and mixed status families have access to all the supports that everybody in the United States of America has right now and should have. I could go on and on and on. I have a long list because one of the things we know is that when this many people are having the same types of problems, at the same time, we don't have an epidemic of personal failings. All the time when we look at our system and what's happening with caregivers, we see it blamed on the caregiver. Like, oh, you just can't figure out how to schedule it all. That's not true. We have a national system that's broken that we can and we will fix together. So I know that everybody out there is going to join with us to fix it and to build it back better. So aren't you glad you asked? I have the longest laundry list.
It was perfect. And I'm so glad you said that, because one of the things that I think we face in so many aspects of our society that are broken is the idea that it's the individual's fault rather than the system that's designed around individuals to organize people into a way of doing things that is efficient. That system itself is broken, but the brokenness of it makes us think there's something wrong with us, as opposed to something wrong with the organizing principle of how people are brought together to create an efficiency, whether it be around care, whether it be around wages, all these different things. Kristin said one of those words where, in a game show, you go like this because you heard the magic word. She said universal, which means for everybody. Yeah. And I know at NDWA and at Caring Across, we've been talking about some universal stuff. Yeah. Coming out of this crisis, what are the things that we need to be putting in place to make sure that we are never in this place again?
Yeah. Well, it goes back to your question around why things are so piecemeal and such a mess. And I think we've kind of, to your point around organizing principle and how we design our systems, we've really siloed, right? Workers over here, consumers over there. We've siloed childcare from elder care, from paid family leave, when actually it's all about how we take care of our families in this moment, in the 21st century, across the lifespan, right? Each of us is working and we have families. I mean, not everybody, but we all have even chosen family, right? We all have people that we love that we need to take care of while we're working. And our systems need to be designed in a much more holistic and universally accessible way that both invests in and supports families and the workers who are going to be a really big part of the solution for American families. And one thing that has happened in the last 30 years that most people haven't really paid attention to yet is the fact that most of us are living longer than ever before because of advances in healthcare and technology. Our average lifespan now is 20 years on average longer than when we first put our safety net into place. So we've essentially added a whole other generation onto American families and our lifespans without anything in place to support a good quality of life and good health and well-being for that additional generation. And so we just have to rethink the whole thing. And we believe that as we start to get on the road to recovery from the COVID crisis, that we have this huge opportunity to invest in our caregiving systems. And we think it's a big part of how we get America back to work again, because we know that on the one hand, caregiving jobs are essential jobs. We're going to need childcare, elder care. We're going to need those jobs to support our families, and we're going to need them to be living wage jobs so that people can sustain doing that work and take care of their own families as care workers. And if we do that and invest in those jobs, those are job enabling jobs. Those jobs support all the other working family caregivers to go out and do what they do, knowing that their loved ones are going to be in really good hands. So if we're thinking about getting back to work, I think investing in our care programs is really kind of like the best way to start. And I think going to be a huge part of how we recover and end up on the other side of this in a place that's not only about survival, but really where we can start to rebuild and thrive.
Excellent. Listen, we deserve care for all. And I really wanted to start like running around my house chanting that very thing. And I hope that that is the chant that is running through your mind right now and keeps running through your mind, especially as the people who are representing you are making decisions as we speak about how care is either being valued or not being valued. We've got a few stories from the chat, so let me share those and see if our panelists have any responses. We've also got a couple questions. First is from Maria Downs, who shared that her husband was diagnosed with stage 4 colon cancer 4 years ago. She says she learned two things. One is that caregivers have no rights or support, and that caregivers have to be advocates for their loved ones. That's definitely a theme of the stories that we've heard today, and that has definitely been my own care experience. Next one is from Alexis Baden-Mayer. While my mom's daycare is closed, I'm caring for my mom 7 hours a day, 4 days a week, in addition to my full-time job, and her paid caregivers are also working longer hours. This is an example of the strain that is put on a system that is not organized well to actually meet the goal of caring for caregivers so that caregivers can give the best care possible. Here's a question from our watchers today, our audience. This pandemic has exposed nursing homes as inadequate for people who work in them and for the residents who live there. How do we organize to improve long-term care facilities? Any thoughts on that from our panelists?
Jennifer, do you want to take a first stab at this one?
Sure. I think one of the biggest challenges that this is exposing is that nursing home regulation, nursing home training, and nursing home engagement are all state and sometimes municipal level standards, don't kind of exist across the board. We haven't, I don't think, invested sufficiently in developing appropriate approaches to training and engaging workers in these facilities. My neighbor owns a personal care home, and he and I actually had a conversation about how many of his workers are being asked to do things above the level of training because there is no supplement of groups of people that you call in for this. There is no additional staff. You have to work with what you have, and that there isn't kind of an infrastructure in place. So I'm hopeful that this will kind of train us all, teach us all the things that we can do to support all sorts of facilities, whether it be a group home or nursing home facility, assisted living, because I think everybody wants their loved ones to be in a safe environment, and everybody wants their loved ones, the people who work with their loved ones, to feel like they have the skills they need. Facilities, they love their residents. They'd want to do everything they could to protect their residents. And we aren't doing, of course, compensation and support that they need.
That's right. So I just want to make sure that the audience heard you, because your sound went out for just a quick second. I think what I heard you saying is that everybody has an interest in making these facilities better. The workers, the caregivers, and the people who are in them, and that there's an opportunity to join, right, across those areas which are typically siloed, right, to reimagine what that, what this system can look like so that it works better for everyone. Thank you for that. I just want to lift up a couple themes from the chat. These are themes that you all will resonate with, I know. Caregiving is hard, and it is also joyful, and lots of people agree. And then the other one is that caregiving doesn't exist in silos. It's interdependent. Everything that we do in relationship to care impacts other people, and that's just a fact. And now, during a global pandemic, all of those threads are really being laid bare for everybody to see. We are all having to worry about, you know, how do I make sure that my loved ones who don't live with me are cared for and have everything that they need? If those loved ones had pre-existing conditions or they had caregiving arrangements before, how do we make sure that they can still access that care that they depend on to survive? All of our nervousness, right, about what we're hearing, the stories, the heartbreaking stories that are coming out of nursing homes and hospitals, not enough protective equipment, but also confusing regulations across state and municipal and counties and the federal government that often collide with each other like car crashes. In a crisis, we actually really need things to move smoothly, right? We don't want any additional surprises. And a lot of us are trying to figure out, what does care look like during the time of COVID? I am so happy and grateful that you all joined us today. Thank you for talking about care. Thank you for exposing care. Care is deeply important to us, and we appreciate each of you for sharing your stories, but also sharing your solutions. Caring across generations, our community is also deep. We build with community organizations across the country to make sure that caregiving is valued and caregiving is visible. Our friends in community organizations across the country, I named a few of them earlier: Jane Addams Senior Caucus, Take Action Minnesota, New York Caring Majority, Citizen Action of Wisconsin, all the groups, Iowa CCI, and so many more are on the ground every single day, advocating, representing, organizing for the good of all of us. Our final video today, speaking of Iowa CCI, comes from Jen, who lives in Iowa.
My name is Jen Wolf, and I'm a person with a disability. I live in Waverly, Iowa with my parents. I help with cooking, occasionally making them laugh, and they help me with the tasks that are harder to do from a wheelchair. With their help, I'm able to live a life that's very full, and it includes organizing with others in the disability community to fight for our collective rights. People in Iowa and across the country who use home and community-based services were already having a difficult time getting support, and now it's even harder with the spread of coronavirus. More of us need to be talking about the important work of caregivers who are risking their lives to help someone else live theirs. Caregivers need the necessary personal protective equipment and hazard pay to ensure that we, and all of our families are safe and supported at this time. Care is about interdependence. I need caregivers to support me, and they rely on me as well. We all deserve to be seen, respected, and honored in our communities. However, in this moment, we see some politicians and CEOs focusing more on profits than people during this pandemic. So far, there's been minimal increase in community-based services, minimal personal protective equipment, and very little attention on paid medical leave and hazard pay for workers. Some are even trying to get people to go back to work early, which puts us all at risk. It's just not right. My question is, how do we ensure that as a society, we start valuing interdependence and the truth that each of us has something to give and needs some support, both in this crisis and in the future?
That was an incredible video, an incredible testimony. There's so many different themes in there, and I'm hoping that our panel can talk a little bit more about what we saw here. We certainly saw an ongoing theme about what caregivers need in this moment, including, protective gear, hazard pay, paid leave. We saw stories of needing to co-create systems rather than have systems designed for us without our best interests or our actual experiences in mind. And for everybody, whether you're giving care or receiving care, the whole caring majority needs to come together. I feel like we should have big M's on our chest, right? Caring majority. There's just questions out there about how it is that we ensure that as a society, we start really valuing interdependence and the reality that every one of us has something to give, and we all have something that we're going to need, right? Both in this crisis and into the future. How do we get around this dynamic we talked about a little bit earlier? Individual responsibility. If you don't work hard enough, you're not going to get there, versus these systems are not actually designed for you to be successful. How do we get there? What are some additional solutions? And then, of course, care as a collective responsibility. Is it just on caregivers to figure out how to make these systems better, or do other people bear responsibility for changing the rules and transforming the dynamics that keep caregivers without a say, and also scrambling to try to navigate systems that are deeply complicated and layered? So let me kick it back to the panel. I feel like all of those themes just made me think, how do we build a caring majority that is feminist at its core, takes care of the people that take care of us, and builds the new kind of infrastructure that we need for this country. I'm going to do a rapid fire round, and I'm going to start with Kristin.
By sharing our stories. Oftentimes we think we're alone in our struggles and what we're experiencing, either caring for those who are younger than us, older than us, the same age as us, across the generations. But when you share your story, you let other people know that they are not alone. You also give a clue to the elected leaders who sometimes forget that we are out here with amazing contributions and also important needs. And then also sharing your story does a third thing. It changes our culture. Oftentimes the work, paid and unpaid, of caregivers is completely overlooked in the media and in our culture, but we are here. So it's time for all of us to say we are here, to share our story, to keep marching, to keep fighting, to keep calling your member of Congress, and to know that your voice is more powerful than you often think. We've all on this moment right now seen change happen when we all thought change couldn't happen. So we know that your voice, your story, your phone call is going to make a difference. And thank you in advance for doing that. And thank you to those who are already doing it.
You're amazing. Let's go to Jennifer. How do we build the caring majority we deserve?
Well, Mrs. Carter has a number one idea for this, which is to ask every legislator or candidate at every level of office what they're doing for caregivers, what their plan is for caregivers, and how they're recognizing caregivers in their community, professional, non-professional, family, that you should ask that question in every interaction, in every town hall, and every endeavor. So let's do it for her.
Let's do it for her. Let's do it for us. Let's do it for America. Ijen, bring us home. How do we build the caring majority that we deserve?
I love both of those answers, and I'm going to double down on those and say that it's time that Congress invested in family care. We should have affordable, accessible care for everyone, and we should make sure that every care job is a dignified living wage job with benefits and a safety net, and we should be visible. And a way to be visible is to join this movement and stay involved. Through Caring Across Generations, or each of us on this panel has organizations to stay plugged in with, and we just want to be connected as a caring majority so we can be seen and we can be powerful together.
That's excellent. You all are amazing. Thank you, Ijen, Jennifer, and Kristin. Remember, care is a collective responsibility that needs a collective solution. You can keep up with our panelists on Twitter. Jen, you can find at Jen Olsen _Dr. PH. And Kristin, you can find at Rowe-Finkbeiner. You can find Ijen at Ijen Poo. And you can follow me at Alicia Garza. Before you all go, as a part of our Care for All campaign, we are collecting photos of caregivers and domestic workers striking the pose of Rosie the Riveter. Can y'all hit the pose with me? And our team is going to take a screenshot. You ready for this? All right, let's do this. And also, if you can move back a little bit, yeah, because we're all up on our screens, exactly. Boom, strike the pose. That's pretty amazing. Yes, yes. Okay, great. Thank you for doing that. Everybody who's watching right now, you can strike your own pose and send those pictures right over to Caring Across Generations. Shout out to Aminatou and Natalie who joined us earlier. This has been such a reach. I've been having talking issues all day long because this is so important to me. You can continue the conversation with us. This has been a rich and deep and beautiful conversation, one that is not only overdue, but I want to know is happening in living rooms and dining rooms and porches and kitchens across the country. Call somebody and talk about your care story, and then also hear theirs. And you'll remember that we are not only not alone, but we are more connected than you probably thought. We understand and we value the work, the love, and the joy that goes into caregiving. And now we need everybody else to value it as essential work. That's right, I said it. Domestic workers and caregivers are essential workers. all of you watching at home, we want to hear from you. Please send us your care story. You can take a few minutes right now and tell us your story, what care means to you, and what your hopes are for your future. You can record it on your phone and upload it at caringacross.org/townhallstory. Super easy. I just did one the other day. You're going to love it. Finally, if you send us your care story, we just might use it in our Care for All campaign, so stay tuned. We so appreciate y'all joining us today. Thank you for being here. Thank you for caring. And remember, care is a collective responsibility.